Another common thing you see is binocular vision problems. So these are issues with being able to use both eyes together as a team. So in this video, I'm just going to go over some common vision problems that people experience after having traumatic brain injuries. I see a lot of these cases, and I've noticed that some people are sometimes hesitant to want to describe the symptoms they're experiencing because they're worried that I'm gonna think they're crazy or making it up or something like that, but definitely don't have to worry about that here. I know there's all kinds of bizarre stuff you guys experience with these. So probably the number one thing I see people come in with is just a general sensitivity to light and just like sensory input in general, but a lot of them are very light sensitive. They're coming in with dark wraparound sunglasses and a hat, and they wear that indoors even because they're just so sensitive to light. They also tend to be sensitive to movement, especially like movement in their peripheral vision. So some of these folks can't even like go to the grocery store and walk down the aisle because of just walking down the aisle, all the movement of the products and stuff kind of drives them nuts. So it can get very disorienting for them and kind of limit their ability to get out and do what they need to get done. Another common thing you see is binocular vision problems. So these are issues with being able to use both eyes together as a team. And there's different manifestations of that. There's one nerve in particular that some people get after hitting their head really hard. It's called the fourth nerve, and damage to that nerve will cause one eye to aim higher than the other eye, and you might experience double vision, but kind of one object higher than the other. You can also have trouble kind of aligning your eyes horizontally, which would cause double vision, kind of a more of a side-by-side kind of a double, particularly in converging the eyes for kind of close-up tasks. And so some people with this don't actually get full-blown double vision, but they just, maybe fatigue really quickly, or they'll get like this pulling sensation around their eyes when they're trying to do near tasks or something like that. Speaking of reading, there's other issues with reading in terms of making accurate eye movements. So when you read, you have to make these really accurate, they call them psychotic eye movements, where you read a word or a chunk of a word, and then your eyes make a little jump and get the next piece, and jump and get the next piece, and so on, and so sometimes after brain injuries, these eye movements become less accurate, so you might find yourself jumping too far or not far enough, or skipping down a line, just kind of losing your place. Makes reading quite a bit more challenging, laborious, I guess you could say. Another thing we see sometimes are what are known as visual midline shifts, where your perception of center is actually offset, to the right or to the left. And in these cases, you'll watch somebody walk and they'll be kind of leaning sideways and kind of veering off to the right or the left as they walk, or they're having to like hold on to the side of the wall just to kind of stay upright as they're walking. And so in cases like this, we'll set up sometimes some what's called Yoked Prism, where we can kind of shift the whole world off the other way, which will kind of change your sense of center and help you walk more upright. We also will do prism in the glasses for other things. So if you have some like vertical double vision or horizontal double vision, sometimes we can put some prism in your glasses for that. There's also, tinted lenses are a very common thing. If you need prescription glasses, we can get a tint put on there, any color that you need to help with the extra, light sensitivity that you're experiencing. And then there's also what's called vision therapy, where we can kind of try to rehabilitate the visual skills that you lost from the brain injury. And usually we're doing a combination of those things for a lot of these people.